Welcome to the Eye of the Needle podcast, where we discuss healthcare innovation and explore how visionary entrepreneurs and change leaders are reshaping the future of our industry.
Welcome back to the Eye of the Needle podcast. I'm your host, Pam Arlotto, and today we're diving into one of the most important and often misunderstood topics in healthcare, artificial intelligence. AI has captured the imagination of the industry, but what does it really mean for care delivery? How do we separate hype from reality? And most importantly, how do we deploy it safely, measurably, and in ways that actually give some time back to clinicians and improve patient care? I recently had a healthcare executive tell me he couldn't spell AI. So I thought I would start this conversation with a definition for leaders who have basic questions. AI is like giving your computer a stethoscope and a brain. It's the ability of technology to learn from patterns, make predictions, and help humans make better decisions. In healthcare, that means AI can help spot risk earlier, reduce paperwork, and even suggest better ways to care for patients. In other words, it's a smart helper, not a replacement for people. And a little humor for those of you that can't spell AI, just think of it as automated insights or augmented intelligence. It's like having a super fast, super nerdy intern who never sleeps, doesn't need coffee, and reads every chart, scan, and claim form at the same time. But to explore AI a little bit further, I'm joined by Rachel Rivera, Director of Engineering at Ambience Healthcare. Ambience is a leading AI platform for documentation, coding, and clinical workflow. Live across multiple care delivery settings, Ambient supports 200 plus specialties and integrates directly into Epic, Oracle, Athena Health, and all of the other EHRs. Rachel, you have an interesting background. Will you tell us a little bit more about yourself and how you became interested in healthcare?
Absolutely. And thank you so much for having me on your podcast. So, about 2 years ago, I was actually working in a completely different industry. I was a staff software engineer at Netflix, the entertainment company, which was a great learning experience. How do you scale software for millions of people? And at that time, I had a family member who needed a liver transplant.
Wow.
And so I spent many long days in the hospital. And while he was recovering from the surgery, and I saw something I could really not unsee, which was these incredible clinicians were splitting their attention between my family member and the EHR. They were really burdened by their documentation responsibilities. And, they were hunting for critical updates about my family member's condition buried in pages and pages of copy forwarded notes.
Right.
And luckily, that family member, he's doing great now. He's fully recovered. But the whole process really inspired me to leave Netflix and move to a company that was focused on letting clinicians do what they do best, which is just delivering great care, right? Letting them practice medicine, not paperwork. And that's how I found Ambience. And it felt like the right time as well, given the recent innovation with AI.
Mm-hmm. So when you say right time, tell us a little bit more about why this is the right time for AI in healthcare, why it might not have been a few years ago, and give us a little bit more, a little bit better definition than I gave earlier, and tell us a little bit more about what it is and what it isn't.
Yeah, absolutely. So I think what it is, large language models, they're trained on massive data sets and they just predict the next word. Actually, the next token you'll hear in the literature, but you can think of it as predicting the next word in some context. And at scale, they can actually, read and compose helpful summaries of charts, translate languages, draft structured fields, but they're not sentient. They're not a source of truth. They can even be confidently wrong sometimes. So they have to be grounded, in the electronic health record information. They have to provide citations and timestamps and, have to be deployed with careful benchmarking when you're applying them in clinical contexts.
So when you say not sentient, for those of us who don't fully understand that meaning, tell our listeners what being sentient would involve versus not being sentient.
Yeah, I think machines, they don't really think the way that we think.
Mhm.
So, AI can really seem like magic to a lot of people. And, I don't want to undersell how incredible this technology is, but it still has to be integrated into real workflows in a really thoughtful way with careful oversight for you to see the kind of returns you're hoping for.
Well, and our industry has spent so much money in the last 20 years on EHRs and
Yeah.
ERPs and other types of point systems that are very much IT, information technology, where you build software around a specific feature functionality or set of tasks. What is AI today that is really different from these systems that we put all this money into?
Yeah. Maybe I can provide a brief and grossly oversimplified history of modern AI, how we got here, and
Perfect.
what kinds of developments enable what we have today.
Okay.
So, back in the 2010s, it was really the deep learning era. So, neural nets enabled big advances in vision and speech. Think of voice recognition or being
Mm,
able to auto tag images. That was amazing for narrow use cases, but obviously not as generic as the kinds of language models we see today. Then in 2017, there was a pivotal moment where something called the transformer architecture was introduced. And this allows modeling long range relationships in language. So the model can pay attention to the entire sentence or the entire paragraph, not just the words surrounding it. And well, we talked about that next word prediction. When you apply scale in terms of compute and data, really you can start creating models that can produce coherent text and execute tasks. And so another big step in AI has been something called alignment.
mhm.
So we use techniques like supervised fine tuning or reinforcement learning from human feedback to take these models and actually train them to follow instructions, show their work, and generally produce a helpful answer over an unhelpful one. And so all of this was leading up to 2022, the release of ChatGPT. And we all could see in that moment how this technology can be dropped into actual workflows and become, an assistant for us. And ever since then, there's been really rapid progression at every axis. Better reasoning models, longer context windows for things that the model can consider, faster and cheaper inference. And so I think that whole arc of starting with some deep learning wins, this thing called transformer architecture, applying incredible scale in terms of data and compute to make these general models knowledgeable, alignment so that it's, helpful for us. All of that has led us to the point where we are now, where we've crossed over from AI providing maybe a cool demo to being something that's dependably integratable into clinical workflows.
Well, one way I've shared with some of my clients, and I want to see if this resonates with you, is a lot of our systems were very big, very onerous, but we still had to have people kind of be the
Mhm.
glue between
Mhm.
all of these different systems that didn't really connect with each other. And a lot of the AI workflows today, they're augmenting the people that were that glue. And so you can get into very targeted problems at scale and do them very quickly and very intelligently in a way that no matter how many bodies or people you threw at a problem, you would still have a lot of issues. So I think that changing tech stack that you just described helps explain this new environment that we're not building these huge enterprise systems like we used to. Now we're kind of filling in the glue that people used to be and helping have nurses and doctors and others in finance and other places really focus on the top level of what they were licensed or prepared to do, not doing all that tasky stuff that is part of that glue. Does that resonate with you at all based on what your goals are at Ambience and what you guys are doing with AI today?
Yeah, absolutely. I mean, I think we think of ourselves as kind of the AI intelligence layer on top of the EHR.
Makes a lot of sense. And I know I have a lot of leaders who are very concerned about, is AI safe? And will it really make a difference in care delivery today? Talk a little bit more about kind of how you guys are kind of laying those bricks, if you will, for documentation and revenue integrity and other components with your core capabilities and your tools, your AI driven tools.
Yeah, I think that there's so much there. Maybe we can get started with revenue integrity. I think if you leverage AI in a way that I mentioned that's not grounded in real pain and without an understanding of real workflows, it can cause more harm than good. And
Mhm.
so, a very specific example is maybe you can use AI to create documentation on a clinician's behalf. But if that documentation isn't coding aware, it's not compliant, maybe it saves the clinician a few minutes, but then it just costs the revenue cycle management team that time. So you're not solving a problem, you're just pushing the problem to another part of the organization. And that's one of the reasons why for Ambience, a note that is not coding aware is an incomplete note.
Mhm.
And we
Mhm.
we spent so much time here. I talked a little bit about alignment in the brief history. We used that. We used OpenAI's reinforcement fine-tuning to actually train our model to be great at coding. So we have an ICD coding assistant, for example, that will suggest precise ICD-10 codes based on what we hear the clinician talk about. And, with that reinforcement fine-tuning, we found 27% relative improvement compared to physicians' benchmarks. And so there's really the AI can be incredibly powerful, but if not plugged into the workflow in a responsible way, can just cause more issues than
Right.
anything.
Right.
That's one component. You also asked about safety, and it's something that we're thinking about constantly. Our product philosophy that this is a co-pilot, not autopilot for
That's
clinicians
great.
and revenue cycle management teams.
Right.
So we have humans in the loop. They're providing final sign off for anything that we generate. We have really rigorous benchmarking for all of our models, and we'll freeze a model after we've done benchmarking and not upgrade it until another round of benchmarking if we find other use cases. We start really narrow when we release things. We release them just to maybe one or two trusted clinicians who will provide feedback. We make sure that we have extreme auditability of everything in our system, everything the model has as input, everything it's producing as output. And safety also has to be like tailored to the specific product. So
Mhm.
what safety looks like for one of our products in our platform is not exactly what it looks like for another product, but
Makes
definitely
sense.
it's something that's top of mind.
That makes sense. So when you're using these different AI driven components, are there things that are kind of part or the way you operationalize it across different different environments or different use cases? Are there some things that are similar or common, that those principles that you might have, whether you're at an Epic site or an Oracle site or some other? I mean, can you share some of those principles and what you see when you roll those out?
Yeah, absolutely. So there are some things in common and like certain safety practices that apply across the board. Like I mentioned, auditability, treating as a co-pilot, always having a clinician in the loop. But there is quite a bit of variation as well. And that's
Okay.
part of the fun of developing this platform. One thing we found way earlier on, a couple of years back, we had great adoption with primary care.
Mm-hmm.
But when we started expanding into other specialties, the adoption just wasn't there. And so, obviously, I think your audience is going to know, well, of course, there's this rich heterogeneity across specialties. So when we dug in, we realized that we had to really re architect our system and not only change the models per specialty, but we also had to change the workflow, like the discrete buttons that providers see in the app, in the EHR, the discrete data elements that we pull from the EHR by specialty, subspecialty, and care setting differed. So that's really a fun challenge for our engineering team that we're constantly tackling.
So I assume you have to do a good bit of really getting into the brains of cardiologists or oncologists or even a certain area like emergency department and really map what is unique in those settings to be able to do what you're describing.
That's exactly right. I mean, we have a scribe product, but we don't think about having just a general scribe. We have a cardiology scribe, we have an oncology scribe, same thing for our coding products.
Mm.
And we're lucky to have some incredible physicians in-house at Ambience who help us do some of this research and discovery. And we also work closely with the health systems that we serve in order to kind of get those insights.
So is there a specialty that you guys have seen, just adoption take off and then others are still they're adopting, but they're a little slower to move forward? Or is it just really getting the tools built in a way that map to the unique requirements of their specialty?
Yeah, it's something we have spent so much
Mm.
time on that we have reasonably good adoption across the board for our supported specialties. We recently completed an enterprise rollout of our software at Cleveland Clinic,
Mhm.
which, is known for the breadth and depth of all of their specialties. And we found that with active users, there's over 75% utilization on average across the board. So there's still room to grow. It's something we constantly have to work on, but something we focused at least 2 years on and will continue focusing on.
So I assume change management, change leadership is a really big part of getting that adoption for those unique specialty needs. But
Mhm.
are there some tricks that you guys have found or things you always include as you're introducing this change to your clients that you guys find really are helpful in getting that adoption?
Yeah, that's a really great question. I think a few things. One thing that we have is we're integrated directly inside of these electronic health records. So we're
Mhm.
meeting clinicians where they're already at in the workflow.
Mhm.
And that's kind of a non-starter across the board for
Right.
adoption we found. And one thing we provide is we actually have a chat box. So you can click and chat with somebody on our team at any time. And so having a direct path for clinicians to talk through some challenges they're facing with workflows is something that's really helpful. And, we leverage AI internally to help garner insights from those messages. That's one thing. Another thing that we do is we try to be as data driven as possible to
Mhm.
identify gaps. So I talked a little bit about utilization. So we can see, for every one of your scheduled visits in an ambulatory setting, for example, how many times are you actually reaching for ambience to write the note? And when we see variation across specialties, we can kind of dig in if one specialty is a little bit lower. Another thing that we try to track is the time spent in the chart. So for Epic specifically, there's something called user action logs.
Mhm.
It shows you how much time people are actually spending inside of the EHR. And we use those extracts to really get a sense of where is the technology helping to save time for clinicians? And if we're not seeing time savings, what's contributing to that?
Right. Right. That's interesting. And so of I know a lot of what you do is augmenting the scribe or
Mhm.
and that is a position that's kind of grown in the industry as a person-centered way to address this documentation dilemma in our industry. But I would assume that looking at that time and chart, you're able to see, can we augment the role of the scribe or even replace the role of the scribe and allow the clinician to be the one in the chart? I mean, is that a change you guys are seeing as well?
Yeah, I think when we dug into the data with our AI scribe, we're seeing less time actually writing the documentation after the visit, as well as, all of our coding assistants help after the visit.
Mm-hmm.
One really interesting thing we found when we were digging in was we weren't helping clinicians at all. They were still spending a lot of time in the chart before the visit. And so, this is where, we started expanding from just a scribing and coding company to a full platform because there are so many opportunities to help augment workflows, both
Right.
both after the visit, but pre-visit, during visit. So we released a feature called Patient Recap that provides a summary of who the patient is, their discharges, ER visits, medication changes, etc. So that instead of an electronic scavenger hunt to try to get a download of who this patient is, they have it available for them immediately and can save a little bit of that time before the visit as well.
That's so great because all of us, if we've been patients, we've been sitting in the room waiting on the clinician and we hear them outside the room going through the paper chart,
Yeah.
trying to do what you just described. So it's nice to have that recap there in front of them so they don't have to go through that scavenger hunt as you describe it. That's perfect. So that's the pre-visit or telling the kind of reminding the clinician about the history. What changes during the visit?
That's a great question. So, after we released Patient Recap, we realized that providers often had follow up questions.
Mhm.
So, they see something in the summary, and in an ideal world, they could ask some natural question and get a chart aware answer in seconds to really benefit during the visit as well. And so, we recently released what we call Chart Chat,
Mhm.
which is an application that can leverage the context of the patient record to answer their natural language questions. And again, that point of safety, what's really important to us is traceability, both for Recap and Chart Chat and all of our products. So we have link back to where we got this information. What is the evidence that led the AI to respond with this specific answer?
That's great. So what happens next? I mean, so they can ask questions. What happens beyond that for that clinician in terms of the role you guys play immediately or during the visit or immediately following it?
Yeah. Yeah, we really are thinking about before, during, after. We have Chart Chat, try to help answer questions during the visit. We create all of the documentation for the visit, the full SOAP note, which obviously has to be specialized, different per
Right.
specialty. And we create this documentation in a way, as I mentioned, that is coding aware. So we have a number of coding assistants that make it so that you feel like you have a billing expert in the room with
Oh,
you.
that's good.
So we have this ICD-10 assistant that can surface precise ICD-10 codes. We also have an evaluation and management coding assistant that can suggest the correct CPT code for
Mhm.
the provider.
Mhm.
We also have recently released a real-time compliance checker that will read the assessment plan, and for any HCC linked problems, it ensures that it has proper meet criteria.
Mhm.
And
Mhm.
so even as you're editing, we're constantly running this model over and over again to make sure if what you've documented has proper substantiation to prevent compliance issues right there in the moment, before it even reaches downstream teams.
Right. Right. That's going to save a lot of time, not just for clinicians, but for the administrative folks and the revenue cycle folks, et cetera, et cetera. So that's great.
Yeah, and I think we care a lot about making sure that we're actually delivering value to providers.
Mm-hmm.
Um, but we also care a lot about the patients. So some of the things that are also happening after the visit include creating a detailed after visit summary that can be provided directly to the patient without any medical jargon. You know, I think back to when my dad finally went home and we felt very overwhelmed with following the care plan. So, something that is an artifact generated in real time for the patient. And we're even starting to research and prototype voice agents that can call patients and make sure they're following their care plan.
And that care plan, I assume, is going to be built based on the specialty, their diagnosis, they're an inpatient versus an ambulatory visit versus an ED visit. So that's one of the nice things about AI. You can take all of those different complex environments, diagnoses, et cetera, and build out a specific uh, plan that you're going to reinforce? Or are you using content from some of the care plan companies, or you got guys kind of doing a little bit of both? How does that work?
Yeah, great question. It is the former.
Mm-hmm.
We have fine-tuned models for each specialty,
Okay.
and we are generating the care plan ourselves based on what we heard from the visit, context that we're pulling from the chart. We're
Okay.
integrated with the diagnoses and the problem lists so that we can create that comprehensive care plan, which is confirmed by the clinician before,
Mm-hmm.
handoff to the patient.
So, are there other aspects or components of that visit, or of what you're providing, any roll-up data or analytics that you're doing to kind of let the practice know or let the health system know kind of what's happening in these visits? Are you guys pulling any safety data or any governance data, anything that would help them manage their visits in a better way?
Yeah, absolutely. A lot of the things that we're tracking, we're sharing our findings directly with the health system.
Mhm.
So we're tracking time spent on in chart and we're sharing that directly with the health system. We're tracking utilization across all specialties and sharing with the health system. We are tracking revenue integrity at point of care. What does ICD-10 coding, E&M coding, HCC capture look like before and after ambience?
Mhm.
One of the benefits to being really deeply integrated with the EHR is you can really get that before and after picture. And so we always share with the health systems because we know that evaluating us as a potential vendor, the best thing we can do is make sure they're empowered with all this information. And then in terms of safety, we often do third party validation. So, as a specific example, the coding assistants, we actually have the American Association of Professional Coders do audits of what the AI is generating and share those artifacts with health systems. And I think those are a few examples of things we share.
It makes
Um,
sense, because it helps both you develop the product, but also the organization improve their own performance, their own quality, et cetera, by having that information. So help some of our listeners differentiate your role versus the role of the EHR. So from a strategic lens, how would you position the differences in those offerings?
yeah, I think the EHR is going to continue being the system of record, right?
Mhm. Mhm.
And we can really provide that intelligence layer on top of the electronic health record. And it does require us being deeply integrated with these electronic health records, which we spend so much of our time doing. You know,
Mhm.
for example, with Epic, we have the ability to record directly from inside of Haiku. We have a hyperspace integration. But providing that intelligence layer is something we're uniquely positioned to help do, especially given the fact that we work directly with foundation model makers like
Right.
OpenAI to make sure that we're developing this in a way that's innovative, but also, as we mentioned, safe and compliant.
So, do you anticipate that the Epics of the world, the others, will develop their own competing AI offerings? Or do you expect it's going to be, yes, they'll go their path, we'll go ours, but we'll continue kind of that hand in glove relationship?
Yeah, it's a great question. And Epic has recently, for example, announced, and other EHRs as well have announced their own offerings that are currently under development.
Right.
And, I think the way that we're thinking about it is a company that is dedicated entirely to this AI intelligence layer as their bread and butter with all of the learnings that we've had over the last 5 years as a company and our special relationship that we have with some of those foundation model makers make us uniquely positioned to continue driving value. We also recognize that we can never do any of this in a silo. So everything that we're developing is in deep partnerships with the health systems that we serve.
That makes sense. And that's always been the case. I mean, back in the day when there were companies that built emergency department systems, for example, they had much more depth than some of the core vendors who also offered that as part of their footprint. But in reality, you had to kind of decide, do we want the depth or do we want just enough to get by? And so I think what you're describing is the depth. And then for some, they'll choose the just get by approach. But that's a really interesting perspective because you'll always be able to research a little bit deeper, go, solve the problem in a little more curated way and be more creative. So that's an interesting and probably an appropriate philosophy. So, can you talk a little bit more about implementation and measurement and almost give our leaders who are thinking about going down this path a checklist of things they need to be looking for, thinking about, and the kind of the performance they should be expecting if they move forward with an offering like Ambience has?
Yeah, absolutely. So actually at Cleveland Clinic, they ended up piloting a competitive pilot with 5 AI scribing vendors,
Oh,
including
interesting.
Ambience, all
Interesting.
at the same time. And so some of the things that Cleveland Clinic looked at include, EHR integration, depth of integration. We've talked about something that's important. Clinician experience, NPS surveys, what kind of like third party validation for the AI, which we also talked about, some of those AAPC audits, time spent in chart, utilization across complex specialties, revenue integrity, visible safety artifacts. A lot of that we've already talked about as potential buy-in criteria.
Mm.
And we were lucky enough to be picked for enterprise expansion with Cleveland Clinic. I know we just crossed the threshold of 1 million encounters documented with Ambience at Cleveland Clinic. But I think the way to think about it in my mind is prioritize performance over promises and really test and don't just trust what vendors are saying. It's almost trivial nowadays to create a compelling looking demo.
Right,
And,
right.
and so,
It's kind of the table stakes. You got to do that to even get in the door. So yeah.
and so I think a lot of what health systems can do is think about what your success metrics are at the very beginning. So, some success metrics are, I think at St. Luke's, we were able to show a 39% reduction in time spent documenting
Wow.
with 40% reduction specifically outside of working hours. Or I know you had Mac Boyder on the podcast
Yes.
recently
Yes. Yes.
from class, research director, and he actually co-authored a study alongside St. Luke's to
Hmm.
show that clinician experience improved after deploying Ambience. as well as documentation integrity.
Mm.
And it generated more than $13,000 per clinician annually, um,
Wow.
because of the more accurate billing with all of our coding features. So, if you can see vendors that also have some of those independent studies of the true outcomes from deploying the technology, I think that can be helpful as well.
Makes sense. Well, one thing Max said in his conversation with me was that we were really just in the early stages. It's kind of the wild, wild west out there, if you will. And how do we use AI for documentation and revenue improvement and workflow performance? But we have a lot of opportunity ahead of us. So, can you share with our listeners kind of your future vision or your company's future vision of what do you see happening in the next year or so? And then beyond that, say in the 2 to 4 year time period, and then even longer term. I mean, what kind of accomplishments and results are we really going to see AI having? What's the impact going to be?
Yeah, it's a really great question, and things are evolving so rapidly. It's sometimes hard to imagine what the future is going to look like.
Right.
I think right now we already see these copilots that are embedded at the point of care, automating administrative tasks. I think cost structure of RCM may shift materially in the next few years, where instead of people having to manually audit, and I think Mac mentioned this as well on the podcast, of like AI agents that are coming to an agreement for something like prior authorization.
Yeah, he talked about having the payer AI agent arguing with the provider AI agent and them coming to an agreement. It was great. It was so we won't have to have people negotiating. We'll just let the AI agents go after each other.
That's exactly right. And I think ultimately what we're hoping for is a reimagined patient experience eventually, with contextual agents that can help with scheduling, follow up, and education, and reimagined way to practice medicine that really leans into what humans do best. Some of that clinical decision making when they are given the proper context and the rapport building, and not the tab hunting or the typing.
Well, and so much of the way our data and technology initiatives have evolved has it's been hung on the old infrastructure of the way healthcare evolved over a 50 or 75-year period. We did it this way because it's the way we've always done it.
Right.
That's what's so exciting about these new tools and the opportunity ahead of us is we'll be able to do things we couldn't even comprehend 3 or 4 or 5 years ago. It'll just take us to whole new levels. And I find that very exciting. And I personally believe it's going to solve a lot of the cost and even workforce issues we've had in recent years because we'll be able to do things so much faster and so much more depth and across at a scale that is just mind blowing compared to the way we've always worked in our industry. So
Yeah.
I have one more question for you. It's the way I like to close a lot of these sessions. I always ask, there's probably one thing that we haven't talked about today that you think's important for us to discuss with our audience. So, what is your one thing?
That is a really great question. Yeah, I think the big thing I always come back to is that this technology can feel really scary to adopt, but there are ways to mitigate that risk. And as long as you are staying grounded in the mission,
Hmm.
um, it can really transform the patient, provider, and healthcare organization in fundamental ways, even today. So, waiting to adopt it is only going to hurt your organization.
Well, and I've talked to several leaders who are like, we're not doing anything innovative. And I'm not sure what that would be if we started a innovation project. And I'm like, well, why don't you just experiment with AI and learn? Use this as a learning process, less about trying to invent something new or innovate something new. There are a lot of people out there doing that, but use this time to learn, because if you put it off, you'll have to catch up, and you might
Yeah,
as well explore, kind of have an adventure and begin to learn how it impacts your day-to-day workflow. And I think people will be surprised, and it won't be as scary if they play a little bit with it. So,
absolutely. Absolutely.
and find good partners to do that with. So, well, Rachel, thank you so much for your time today. I've really enjoyed talking with you, and appreciate so much your input, and look forward to hearing a little bit more about where you and Ambience are going in the next few years.
Thank you so much, Pam, for your time today. Really enjoyed the chat.